This is Brampton in North Cumbria, a small market town with what seems, on the face of it, to be a typical NHS general practice, a place where patients can come and see their GP and, if more complex treatments are necessary, get a referral to the area's district general hospital.
Come in, Tony. If you just have a seat there, Tony.
But of late those referrals have been happening less and less. In the past, patients such as Tony Peacock, who's suffering from a painful and growing toenail, would have been sent for a minor operation at Carlisle's Cumberland Infirmary, some miles away. Now he can get his condition treated here by his local doctor, Peter Weaving, quickly, efficiently and in familiar surroundings. It's all part of a new region-wide programme, known as Closer to Home, through which Cumbria's Primary Care Trust is seeking to significantly improve patient care and make its hard-pressed budget go much further.
The programme works basically by trying to get more services provided out in the community, more specialised services, more community support for patients. And essentially what we're trying to do is we're trying to look at reasons to avoid admitting people to hospital or referring them to hospital unless that is the best place for them to be.
The scheme was an innovative response to financial problems the PCT, headquartered in Penrith, faced 2 years ago, when a £56 million budget deficit seemed likely to result in widespread cuts in services. But a new trust management team realised that there was a better way to proceed. This emphasis on community provision is very apt in Cumbria because of its unique geography. The lakes and mountains at its heart are internationally famous for their beauty and tranquility, but with a 500,000 strong population spread around the edges of the region, health managers have had to pay heed to public demands for truly accessible services. Another consequence of the changes, which have been designed in close consultation with social services, is that community medical staff have had to take on board new skills and responsibilities.
Hi Ron!
Evening.
I'll just go enjoy your antibiotics. Okay.
Jane Dickinson is a prime example of this new approach. She's one of a team of nurses who now treat Ron Paul at his home in Kendal. He suffers from poliomyelitis, and 4 times a day he needs intravenous antibiotics to keep infection at bay. Previously, he would have had to stay in hospital in Preston, some 40 minutes away by car. Getting his treatment at home frees up a hospital bed for a more acute case and affords Ron and his family a more normal life.
It's great you have your friends coming around to see you, where in hospital they're limited at times. And if I was down Preston, for the work you come down there every night, it was costing a lot of money, plus sometimes you couldn't get a lift down. So I see everybody, family, friends. It's pretty good, it's really good.
Back in Brampton, where Tony Peacock's toe has now been treated, it's this sort of positive response from patients that has helped secure the support of clinicians like Dr. Peter Weaving.
We've taken all the individual components, the district general hospitals, the community services, the general practitioners, and we've looked at a radical solution for Cumbria. We've now got a plan for all those components to work in a different way, which solves the health problems for Cumbria and delivers a better service for patients, which indeed will be closer to home.
With health budgets nationally coming under strain, PCT managers across the country will increasingly need to think imaginatively about how to meet patient expectations and maintain standards of care. If Cumbria's initiative continues to prove successful, many may fancy a trip to the Lake District to see how it's done.